Aloha kako. Welcome and thank you for joining us today in our third in a series of programs where we're talking about healthcare on the Big Island in particular, but of course we're concerned about all the healthcare needs across the state. This is our opportunity to talk about legislation that was just recently passed during the 2009 session. And we think that there's some very significant progress being made with respect to health care. And so we'd like to share that with you. And joining me today are our distinguished guests. And I would ask them to please identify themselves for the audience.
My name is Josh Green. I'm the senator from West Hawaii, Kailua Kona and Kohala.
Hi, I'm Senator David Ige. I chair the Senate Health Committee. I represent the Aiea and Pearl City communities.
Aloha mai, I am Bob Lindsey. I serve as Hawaii Island Trustee for the Office of Hawaiian Affairs.
Thank you all for joining us today. And let me first start by just saying that David, Senator Ige, as chair of the Senate Health Committee, with great support from our own Senator Josh Green as his vice chair, I think accomplished a great deal this session. There was some very significant legislation passed, which I think really helps to provide a firm foundation for our healthcare needs going forward, but in particular with respect to the state hospital system. So I would just ask David if he could just start this discussion by just informing us about some of the key legislation.
Well, thank you, Russell. I think we need to kind of start at the beginning a little bit and just talk about. I'm just very fortunate that so many senators and clearly even Senate President Colleen Hanabusa really felt that healthcare was an important issue this session, and most importantly that Hawaii Health Systems Corporation, really representing the 13 facilities throughout the islands, are really just a critical piece that we need to take action at. And as you know, Senate and the House did go around statewide and had public hearings through the interim to really listen and meet with community members about the challenges facing the corporation. So, coming into this session, it really, there was lots of interest, there was lots of angst, there was lots of focus on really trying to ensure that these critical facilities can not only continue to operate, but continue to provide quality healthcare services in each and every one of the communities. So, I think that we got a lot done for sure, but a lot of that was really because of the focus of all the senators. As you know, we had a working committee of about 7 or 8 senators all engaged, who were more than willing to help resolve and work through the issues in many key areas. Both of you were involved, Senator Takamini from the Hilo side, as well as all the other neighbor island senators, was really engaged because of the importance that each and every one of these facilities means to each and every one of our communities.
Mm-hmm. Maybe we should put up that graphic, showing the facilities statewide, and I think that would give our viewers an opportunity to see just exactly what makes up the Hawaii Health Systems Corporation facilities across the state.
And if I could add to that, to what our Senate Vice President is saying, going into the session, everyone was aware that it's hard to get health care on the neighbor islands, and the questions that were raised were, what constitutes safety net services? What do we have to have on the neighbor islands? Because a lot of people who live on Oahu, they don't necessarily feel the same urgency and shortage of care because there are more physicians and it's a much tighter geographic area, so there are more hospitals. So when we took it to Chairman Ige as an absolute kind of a crisis for ourselves, like we describe it as a crisis, a healthcare crisis on the neighbor islands, we asked Chairman to get the information to help us come up with not just a short-term plan, but I think the way the problem was framed by Senator Kokubun was, with me and all of our colleagues, we have a short-term need to address the crisis, and then we have intermediate and long-term solutions that have to be dealt with. And so that, I think, is the charge that Chairman Ige took up, that David took up. And so as he describes the bill, I think you'll get a feeling that we had to immediately figure out how to keep the hospitals open and functioning at 100%. And we also had to see what the roadmap would be going forward, so that 2 years and 5 years and 10 years from now, we had a healthier health system that kind of represented our communities. And that's what I think you'll get from this half hour today. So I think Chairman Ige can really inform us about that bill.
I think that one of the other things I think is very important to get on the table from the beginning as well is, clearly we tried to be inclusive and collaborative in our conversations. We had many meetings with not only the CEOs of the facilities and the regions, but we also included representatives from the labor unions, because we do know that any solution has to be global and has to include everybody. And I was just amazed at how everybody, the senators, the community members, the CEOs, and labor representatives were so focused on the task at hand, which really was, how can we best improve access to quality healthcare services across the state? And clearly, in almost every instance, it means the facilities that are operated by the Hawaii Health Systems Corporation. So it really was a good environment, I think. Everybody really took off any preconceived notions, and more importantly, everybody was willing to roll up their sleeves and really contribute to help find a solution. And although I'm lucky to be chair of the committee, I really did want to note that everybody, at least on the Senate side for sure, had a hand at trying to shape the solution. I'll just go through a couple of real key important parts. One of the things that we heard from the corporation loud and clear was, really there was no way for them to reduce services. And more importantly, from the fiscal perspective, they couldn't reduce services that was really costing too much money for any reason. And so the first part of the bill really engages the community to really determine what are safety net services that are absolutely critical to be provided by each and every one of these facilities. And I think more importantly, continue to engage the community to talk about what the future of the hospital should be, and maybe what new services can be provided, or what kinds of changes can be made to better serve the community. This really community engagement, I think, is critical, because we need to have our communities really be a part of these facilities, not only in helping them succeed, but really trying to decide what services they really need.
And to give people a perspective, Chair, 2 years ago we passed a bill about the health system which created regional boards. And so each region, like West Hawaii, the Kona board, East Hawaii, the Hilo board, have a bunch of very committed members, and they have their own CEOs. And so they're doing some of that work. But what Chairman Ige is explaining is now, going forward, as the community gets involved even more, they'll be able to say, yes, in Kona, we want more OBGYN services. In Hilo might have a different feeling, and so the community might say, we want more heart services, more cardiac care. And a lot of what this bill does is it gives them the ability to make those decisions, because I think we all recognize that with the economy being very tight, very tough, there's no room to waste any services, but we don't want any community to be left without. So this will mean the local control is going to be important, and I think that was what Chair got into the bill, which was terrific.
Right. I mean, and I do think, in the 4 months or so that we've been really working in detail on the bill, it became very clear, even though sometimes from Oahu perspective, all of the community facilities look the same. And I was very surprised at how different they are. Each and every community really has different needs. And part of that is because the private sector might have responded